Welcome and thanks for joining us at WYCC.org for In the Loop, the After Show. Our guests, Darren Reesberg, Executive Director of the University of Chicago Institute of Politics, Joan Esposito, partner at J2SC.com, and Republican strategist Lenny McAllister. Welcome to you all.
Thanks for having us.
We learned this week that the UIC Chicago trustees have approved a new health plan there, and in it includes coverage for sex change surgery. Kind of novel for a university. Joan, is this something that should be included in a university health plan?
Well, I think the problem is, if you have a broken bone, you can see that. If you have a tumor, you can see that. With something like this, where it's just a person saying, this is how I feel, it's like some of the difficulty in coverages for various, treatments for mental illness. It's hard for some people to justify paying for a disorder or an illness that you can't see, that isn't obvious, that some people suspect is just in your head. So, as a state taxpayer, do I want to fund this? I'm not sure. It seems sort of above and beyond, perhaps, the basics.
Yeah, I would see. I think it is a bold move that the University of Illinois Chicago is making. But I do think that if somebody is dealing with the issue of them being in the wrong body, it's best to be addressing this at an earlier age than later on in life, to give the person the life that he or she is looking to live.
But the opposite argument could be made, that if you're that young, perhaps you need to give yourself some more time to really know that this is the right move you're making.
Yeah, I think I think there's likely the case, and I don't know this for sure, so this is something I'd want to read up on, but that there would be significant counseling for individuals that would be going through this process beforehand, and that is an age where somebody is mature enough to be making this decision and understanding themselves. Just I would say the same thing with respect to their own sexual orientation, which I think one knows, before he or she is.
But the question that Joan raised, and we'll put this to you, Lenny, is, this is a taxpayer-funded institution, and some of these kids are there on taxpayer rides, and should taxpayers be funding what may be an elective surgery?
This is a bold move, and it's the wrong move. Number one, sexual orientation is a brave decision to come out, but think about what the obstacles that people go through talking to their parents about this. Now you're talking about young people that are going to have a hard time perhaps talking to their parents about this. Their parents may be paying for tuition, may be paying for expenses, and may not be part of the decision-making process. We're not talking about full-fledged, liberated adults that are fully taking care of themselves. So now you have this quasi-status of people that may still be living at home or living partially at home. They may be going away to school at UIC, that are now making these decisions that parents who are obviously emotionally invested, may still be economically invested, as well as the state. They're now involved in a decision that, like Chris said, is an elective surgery that we're still trying to come to an understanding for, and we're talking about perhaps a 20-year-old or a 19-year-old, somebody that may not be able to hit the age of 21 and legally have a beer yet, may be looking to do this because of where they feel right now, and it's something that the school should not be involved in, and it should not be pulling the state into this decision as well.
Is there a fundamental difference between funding this kind of surgery and funding, for example, contraception?
Well, that's been very controversial on a lot of campuses, whether or not health plans should fund contraception. And again, it's, the necessary versus the elective. If as a taxpayer, if I have to choose, I would fund contraception.
Right, and again, this is not anybody requiring that the University of Illinois at Chicago make this decision. This is a board that's put in place by the governor, and to the extent that the people feel that this is not something that should be done, there are ways to be letting the governor and his appointees know that. One has to question, if it's the case that there are a number of private institutions that are actually covering this and making that decision without taxpayer dollars. Is it the case that a student who is going through this type of issue but doesn't have the money to be going to a private institution should be availed of this opportunity to go through this type of procedure, and yet somebody that's at a state institution not? Those are just questions.
Couldn't you ask, Darren, that there are other health care plans that may provide for this type of flexibility to be able to pursue this path if you feel this is best for you, whereas now you're asking a taxpayer downstate to be part of this decision that they may be against, that they may not be aware of, and we're still talking about a state that's in huge financial straits.
And that's a tough political decision, but we are out of time, unfortunately. So, thank you so much. Darren Reesberg, Joan Esposito, Lenny McAllister, we appreciate your time very much. Until next week, good night.